I'm Amanda Marr Chung, and I'm the Executive Director at the Stanford Center for Innovation in Global Health. My leadership project focused on integrating gender equity into malaria programs for UCSF, where I spent the last 10 years in various roles. A total of 43 countries are malaria-free, but the remaining malaria-endemic countries are low and middle income. Women bear the health, societal, and economic burden of malaria more than men. It's for this reason that I chose to focus on integrating a gender-intentional lens into a malaria organization to address the gendered impact that malaria has on women and girls as patients and the impact women can have on malaria as providers, whether as caregivers, healthcare providers, entomologists, researchers, or program leaders. As background, the Malaria Elimination Initiative, or MEI, is based at the University of California, San Francisco, within the Institute of Global Health Sciences. It works in nearly 30 countries in sub-Saharan Africa, Asia Pacific, and Latin America. The organization is especially well poised to reorient its work as one of the few in the malaria space with an all-female leadership team. Malaria is the fifth leading cause of death for girls 10 through 14. It's a contributing factor to missing school, which can result in early marriage, childbearing, and sexual exploitation. As caregivers, women spend greater than 4 times the number of days on caregiving for malaria than men. And as providers, women community health workers spend 4 times as many hours on unpaid work compared to men. Additionally, while 70% of the global health workforce is made up of women, only 25% hold senior roles. I developed goals to guide the MEI strategy first with the leadership team and then with the entire team's input. Please keep in mind that while I developed these for a malaria organization, these are cross-cutting goals and strategies that can be adapted and used across health programs. 2 such goals include ensuring women's leadership, participation, and benefit from malaria programs and research, and creating safe and empowering spaces for women across programs and partnerships. Guided by the 5 organizational goals I developed, the MEI could then implement strategies to achieve gender equity in malaria programs, equipped with tools and best practices that I'd provided them. 2 such strategies include collecting sex disaggregated data and developing gender-sensitive indicators, and addressing female safety at all field sites through the use of a safeguarding checklist. In addition to developing organizational goals and strategies, I also developed a set of key performance indicators to measure strategy implementation. Similar to the goals and strategies on the last slide, they're not malaria specific. These are just a few examples of the indicators. An example of an internal indicator is the percent of roles where females and males are paid equitably for doing the same job. An example of an external indicator is the percent of projects where gender implications are shared with policymakers, planners, and practitioners. These KPIs incorporated the entire team's input, and then the next steps will involve gathering baseline data and tracking organizational progress over time. I'd like to now switch gears to talk about how this leadership journey has impacted me. It has really helped me embrace my authentic self, encouraging me to exhibit some aspects of my identity that I might have suppressed earlier. It has helped me expand my perspective of the many stakeholders I work with, ensuring I am cognizant and considerate of their priorities, which may be very different than my own. It's given me the courage to stand up, leverage my power, and lead change, and it has underscored the importance of developing and influencing others to achieve greater impact. Participating in this journey came at the perfect inflection point for me in my career, as I was wrapping up a doctorate program, contemplating my next career move, and taking the leap to a new organization and role with greater responsibilities. I am so grateful to the MEI, especially Katie Giesler, Allison Tatarski, my mentorship group, my mentor, my coach, the entire WomenLift Health staff, my amazing team at Stanford, including WomenLift Health founder Michelle Berry, my partner and my two sons, and the incredible women in my cohort who uplift and inspire me. Thank you.